AI isn't coming. It's already deciding who
You
wins.
get care when you're at this point of contact with a clinician, and then mostly you're on your own.
Leaders who are closest to the patient have the clearest picture of where AI can actually help.
It's not just solving. We often read about like what it's solving for, productivity, right? But it's also a patient experience issue.
AI isn't coming. It's already deciding who wins. Let's make sure that's you. Welcome to AI with Bri. I'm Brian Dunstead, and I help leaders turn AI into real leverage, not just experiments. Let's get into it. Each week, we're bringing someone who's navigating this AI shift from the inside, not just observing it, but actually living it in their work with their teams. And today, I am really excited to welcome to the program Joe Harrison. He is bringing something to this conversation that I think is genuinely underrepresented in the AI healthcare discussions that I'm in on a regular basis. It's a clinician first perspective on what it actually takes to build better healthcare for the people the system has consistently treated as an afterthought. Joe is a nurse practitioner and the founder and CEO of Avail Healthcare, a medical group he built by clinicians for the patients who need proactive care the most. We're talking about seniors aging in place, adults with dementia, patients battling depression and anxiety at age 70, who the system decided could just wait. Before founding Avail, Joe spent years in the mobile and ambulatory Medicare Advantage settings. He led clinical teams at geriatric health startups and has been teaching and mentoring the next generation of NPs as a volunteer clinical faculty at UCSF. I think his tagline says it really well. I'll let him introduce that. He is weaving together many threads to realize the quintuple aim of healthcare. And right now, AI is a strong one of those threads, in my opinion. So, welcome to the show, Joe. I am really glad you're here.
Thanks so much, Brian. It's a pleasure to be here. I have huge respect for you, and so I'm honored to sit with you.
It is, tell us the 30-second overview in your words on Avail and the tagline, because I love your tagline.
Yeah. So in geriatric care, it's built very much the same way that most healthcare is, which is you got to go to a place to get your healthcare needs met. And with about 10% of Medicare recipients, they are really falling through the cracks, and they're representing more than 55% of the entire cost of the system. And a lot of that has to do with because the system is built around them coming to clinical care instead of clinical care coming to them. So when I'm building a company to weave many threads, for the quintuple aim, what are we going after? We're going after patient experience, provider experience, patient outcome, health equity, that we're really trying to close gaps in care and make sure that care is actually delivered equally and well, regardless of your social determinants of health, regardless of where you live or what you look like or how much money you have.
I love it. And the tagline?
Oh, delighted to help. The company.
Mm-hmm.
Yeah, no, I discovered very early in life that my life was a lot better if I was working on behalf of other people and not just thinking about myself.
Mm-hmm.
So that's just that's an embodiment. That tagline is embodiment of what I believe works for clinicians and what I believe works for patients. Is that the clinicians want to be there. My job is to make sure that it's sustainable for them, make sure that they have the tools they need, a la this conversation, make sure that their time and energy is spent and it actually results in better outcomes. And also they still get to have a life outside of their work.
Yeah, absolutely. Well said. I mean, I think that's where you and I are kindred spirits. I have a passion for this stuff, and I just love talking to you and geeking out with you and pouring in the little tips and tricks that I know can help you unlock your business.
Yeah.
And I can see that passion with you. And the reason I think I love your tagline so much is because I think that's the unique shift that AI brings to every conversation. Mm-hmm. Every moment with AI by your side can be a moment of customer delight, of patient delight, of patient happiness. We can personalize medicine so well with the help of AI, and we can take care back to what it really needs to be. We can almost make, in my opinion, every experience be a Disney experience if we're guided along the way in some fashion. So,
I agree. I mean, you probably know that 15 to 20% of the total cost of healthcare in America is administrative. And we talk about that in terms of numbers and money. What does that mean on the patient and provider experience side? That means abrasion. That means friction. That means being taxed cognitively, being taxed for your time, being taxed for your effort. And AI has a huge potential to address that on both sides of the healthcare, the healthcare encounter, right? The clinician
mhm,
and the patient.
yeah. I'm looking forward to this first segment here, the learn segment. I mean, clinical entrepreneur building. You're a clinical entrepreneur building this care model for seniors and underserved adults. I think that's a combination of commitment and complexity that most people would not sign up for. Um, and as we're diving into this learn segment, from the front lines of geriatric and behavioral health care that you're dealing with regularly, what is something you've learned recently about AI that has shifted how you think about what's possible for your patients?
Yeah, I think I don't know how you would describe the waves of AI, but I think right now for innovators and people like in the sort of pole position of leveraging AI in healthcare, which I consider myself right now, it's the realization that there is thinking about AI across the different use cases in a healthcare delivery organization, is that there are so many different potential use cases. So one of the learnings is, how do I prioritize? How do I like use the resources I have to deliver the high leverage use cases so that we can then move on to the next, in our roadmap. And so
Hmm.
it's really thinking about provider experience and patient experience. One of the things that I'm most excited about is in the geriatric population, there's massive amounts of healthcare, patient health information. And
Hmm.
there's been a lot of work on the regulatory environment and in informatics and interoperability that has created flows of data. But the next step right now is, how do you then take a clinician who has limited time and deliver data to them in ways that they can process, that they can understand, and they can act on in almost real time to the benefit of the patient and the system, right?
Mm.
So to be very concrete, can you summarize the data? Can you train AI models to summarize the data, but then also to be able to drill down to the source documents, to actually go see when that clinician reads it, right? Oh, people are worried about hallucinations. People are worried about, misrepresentations, right? So you connect the summary to the source document so that the clinician can see exactly what verify, right? Trust but verify, understand
Hmm.
exactly what they're getting, and then be able to have insights into this patient that historically have not been available to clinicians. They're really going on, what's right in front of me right now, and what is a little amount of information I can consume, and then be able to try to make good decisions on behalf of the patient. And this really unlocks more historical, right, context,
Mm.
much more detail about the patient, including what has been tried before. Many patients experience being retried on interventions that caused adverse effects, but we
Yeah.
miss that because we don't have the data. And do they remember all of it? No, they don't remember all the details. They don't remember
Yeah.
every medicine that's ever been prescribed. So this is a safety initiative as well as a quality initiative. But then it's also going after one of those goals I mentioned, which is provider experience. Like, don't feel like you don't have the information that you need to
Hmm.
help this person.
Yeah. Yeah. Wow. Well said. I know I saw someplace you wrote, um, technology's enabling, but the clinicians are healing,
Yeah.
right?
Yeah.
And it's important to point out that I feel like the system that you're operating in and working in day to day is reactive by design. It's waiting for the crisis to show
Yeah.
up before you get to show up,
That's right.
right? So, how is AI changing your ability to be proactive and get out in front of these things? Like
Yeah.
you already hinted at it with your last answer.
Yeah. That no, I think that there's that is so insightful. So if you look at the innovation in the Centers for Medicare and Medicaid Innovation that has been producing new CPT codes, new models, Avail Health is a CMS guide model pilot participant. That's dementia care navigation and caregiver support.
Hmm.
One thing we're excited about that we will be launching in the near future is it fits into the bucket of remote therapeutic monitoring. It's a
Hmm.
way to be checking in and available 24 hours a day, 7 days a week, to be engaged by patients when they have questions or concerns, to keep eyes on, because historically the way that healthcare has been delivered to geriatrics is what we call encounter-based medicine. You get care when you're at this point of contact with a clinician, and then mostly you're on your own until that next point of contact with the clinician. And so one of the things AI gives us is a way to outreach and also receive in communication from patients, to triage that, to deliver it to the right clinician at the right time, so that emergency room visits are averted, right? Patient
Hmm.
suffering is minimized. The cost to the system goes down, but the patient wins as well, right? It's not just, oh, good for the taxpayer, but not for the patient, which a lot of initiatives from big payers have been, right? Like stopping prior authorizations before they're approved, right? Not giving
Hmm.
the patient what they need. This is about giving the patient more, but in a way that is cost effective, and not just in the deployment of the technology, but also in its outcome.
Yeah.
Yeah.
Wow. Such a powerful point. I mean, and I think it hits on one of the things that I keep seeing, that leaders who are closest to the patient have the clearest picture of where AI can actually help and where it could make things worse, right?
Yeah.
And I see that with you practicing each week, and that perspective is really important to this conversation. I think our listeners are going to connect with that. As we pivot over to the leverage section of the show here, you're running virtual care medical group that's showing up in people's living rooms, right? Serving seniors who can't easily get to a clinic, and caregivers who are, like, I don't know, in my opinion, burning out in silence to
Oh,
some degree.
yeah.
That's a resource constrained, high stakes environment.
Yeah.
What are some concrete things that AI has changed in how Avail Health operates? Something where you can really point to a before and after AI.
So this might be familiar to a lot of people already, because it's been in the news for years now, which is ambient AI scribes. For
Hmm.
people like you and me, right, that's like old news. But for a lot of
Right.
people, it's still like, oh, I've heard about it. What does it do? So most people who've received care at some point in their life have had that experience of, the clinician seemed distracted. The clinician seemed so busy putting things into the computer that they weren't really present with me. Or
Hmm.
the visit was not satisfying because there wasn't enough time spent in conversation. There wasn't enough questions from the clinician. There wasn't enough chance to explain myself.
Yeah.
Ambient AI Scribe I've been using now for over 3 years as a clinician, because I still practice. I'm a geriatric psych provider. So I diagnose and treat dementia, diagnose and treat geriatric mental illness. And then I also support younger adults who are disabled from serious chronic mental illness like schizophrenia,
Hmm.
bipolar disorder. Um, and so what I'm able to do is say to the patient, I use this software that actually like listens to our conversation while we're having it. And then it writes a summary note for me, which then I'm able to review and then edit where I decide I need to. And it really speeds up my documentation time, so I can spend more time focusing on you and the conversation and less on documenting. Is it okay if I turn that on? And I've literally done this, thousands of times, and every single time the answer has been yes. And but it's partly because of the way I explain it, right? Is
Yeah.
I'm getting at pain points for patients, and that's what the technology is doing. It's not
Hmm.
just solving. We often read about like what it's solving for, productivity, right?
Great.
But
Yeah.
it's also a patient experience issue. So it's one of those double wins that I love so much, right? The clinician does better, the patient does better. There's actually a little bit more to it too, which is, in geriatric care, there's so much complexity that when we're documenting, we don't have enough time to accurately represent the true complexity that we're managing. So when we submit a claim to an insurance company to be paid, we have to underbill, because the time it takes to document to meet the requirements for the higher billing code is not worth it, because we just can't get through it. Well, Ambient AI Scribe changes that. Ambient AI Scribe allows us to truly represent the complexity of our assessment so that we can submit that higher billing code. And now
Hmm.
I don't need my providers to see 3 patients an hour. They can see 2 patients an hour, which means they can give more time to the patient, less moral injury for the provider because they're really taking care of them. And the outcome is better. So the payer, they might pay more for that encounter, but overall across the population, they pay less because there's fewer emergency room visits, fewer hospitalizations.
Yeah. Wow. I agree. And it is still surprising. You and I are using AI scribe tools all the day. I know we were just talking last week, I think,
Yeah.
about Whisper Flow
Oh,
and how that's
I'm
going to
using that
unlock
every
you.
day.
Right. And so, um, and so I really encourage anybody listening out there, if you haven't and gone down the AI scribe path, like do it. Like it's going to be game changer for you. I think the other important thing that I see in this leverage world that we're in, like how do we leverage AI in what you're doing, is something else I think I was reading on one of your posts was like 1 in 4 adults is now a caregiver,
Mm-hmm.
right?
Yeah.
How are you using AI to support not just the patient,
Yeah.
but like the caregiver who's helping hold everything together while you're not there?
Yeah. It's there's various ways we're doing that. So one of the ways is when you're deploying a care model and you have to think about the unit economics, right? How much time can I pay this nurse, for example, to deliver care for this patient in a month and still keep the doors open and the lights on, right? Like that's the reality, that the transition from clinician to clinician founder CEO is now I've
Hmm.
got to answer those questions too. So when you can literally create a care plan, a detailed care plan that represents the interests of the caregiver, the interests of the patient in seconds, that 2 to 5 minutes that nurse spent doing that for every other patient adds up to more time on behalf of the patient, not documenting, not inventing things from their brain, but actually solving problems, listening, caring, and solving problems. So that the caregiver doesn't see that part of it, right? They don't
Hmm.
understand that they're getting more care than they've ever gotten before. They just think, wow, these people really know what they're doing, and they have the right values. But a lot of times it's not about values, right? It's just about the bottom line. Can you keep the practice open? And so that, doing that extra stuff, and AI enables us to do that.
Yeah. You see that across the board. Like, we all talk about venture capital and the silly stuff we see on TV about it all. But like, if you really tie it back together, most nurse practitioners, most pharmacies, most people that are like exactly like you said in the beginning, just want to help people, just want to pour in that servant leadership, are probably scraping by. Like I was surprised by a fact I heard the other day that most pharmacies that are generating millions of dollars selling drugs are getting by on 100 grand profit,
Oh,
maybe,
I'm not surprised. Yeah.
And it's probably the same in nurse practitioner practices nationwide too,
Oh,
that
for sure.
they're so we've got to really, almost change. And I think the other idea that you sparked in my head was like, we're living in one of the most peaceful times on this planet. As much as we might hear about the news and the craziness of the world, but this is one of the most ripe innovation ages. It's the most peaceful time on the planet if you look back over centuries and centuries of death and destruction. So like it is, and we have some of the best healthcare on the planet, regardless of reimbursements and other silliness that we know. But, so we dive into this leadership segment, that, and this is one of the areas I'm very very curious to talk with you, Joe, because you're a really strong leader in where you want to go. You have a very strong vision of exactly what you want to do with geriatric mental health, dementia care,
Mhm.
seniors aging in place, underserved adults, all those things. And so I feel like building in that space takes a very special kind of leadership conviction to dive into it. Um, there's really a lot of risk inside of healthcare right now that the loudest, most well-founded voices are going to shape where it goes.
Yes.
But that means the patients who are already being left behind could be left behind even further.
Yeah.
How are you seeing your role as a leader in making sure healthcare actually serves the people who need it most?
Yeah. So The first time I launched a company was in 2020. I started building it myself, and it was a private practice, and it had a mobile element and a virtual element. When I say mobile, I mean like staff that go to where the patient lives. Okay.
Hmm.
And I had learned a lot of lessons. I built the model before I understood the economics, right? The reimbursement, and also even like employment law and other things like that. And but really, what I was going after is what where having 15 years now in the business, and I was at that point I think almost 10 years, right? I knew where the gaps were. That's the,
Hmm.
that's where the insight of a clinician gets leveraged as a founder of a healthcare startup. I knew where the pain points were for patients, providers, and payers. Payers meaning
Hmm.
insurance companies. So what I was really building, am still building, is solutions that are like, think of them as vended solutions, so that any entity that is at risk, we call it, meaning like they're left holding the bag if the patients cost more than their revenue, right? And
Hmm.
those are, in Medicare Advantage health plans, accountable care organizations, what we call individual physicians associations that do arrangements with insurance companies to take on risk, that they don't have these solutions available to them in
Mm.
most places in America. So what AI is doing is enabling me to deploy. So it hasn't changed the strategy of the business in the sense that we're still going after the same solutions, the same customers, the same outcomes, but we're able to do more with less. I mean, right now, we have our CTO has the what he describes as the equivalent of 3 engineers working for him that are actually AI agents, right? And now, what does that mean? It means that money that we would have spent, and we're talking about hundreds and hundreds of thousands of dollars that we would have spent, we are now not spending, which means that we can resource other parts of the business, right?
That's right.
And that's
The human side of it.
yeah, and so the leadership is it, like you said, the vision that comes from experience and insight, right? The other leadership is about how to set priorities, right? And where we do launch. Like we actually just made a decision recently to pause some AI work that we were doing because we realized that we didn't have the IT infrastructure to do it in the safest and most thoughtful way. And so were like, okay, well, we know what we need to be true to actually continue that work. Let's make that true and then let's do it. And that's the clinician. Well, it's not only clinicians that have those values, right? But it's about protecting patient privacy, right? It's
Mm.
about protecting provider privacy, right?
Hmm.
When a provider works for a healthcare organization, we know everything about their licensure, their board certifications, their social security number, their all their education history. We know so much about them. How do you protect the privacy of the people that are serving your patients and the patients and their caregivers? And so that's one of the issues that comes up in AI, right? Is like, if you can, are you just like turning over the keys to the kingdom? And it's like,
That's
no,
right.
but that's where leadership comes in, not
That's
just
right.
being expeditious, right? Expeditious with guardrails.
Hmm. I was just talking with another CEO yesterday about uh, back in the day when should we install a web browser on somebody's computer? That might be a security risk,
Yeah,
right?
yeah.
Can you remember those
Oh
conversations
yeah,
20
like
years
well,
ago?
because
Like, should we install Firefox or Safari because there's security risks with web browsers?
yeah,
And now I feel like you fast forward, like we have the same question. Should we install Claude on your computer because it's a security risk?
yes,
And I say, install it, but make sure you as a leader are telling your team how to use it,
yeah,
train them, guide them
yeah.
daily if need be to teach them this new powerful tool that
That's
they
right.
have at their
So
fingertips.
it's
So
policies, it's standard operating
mhm,
procedures, and there's a certain gatekeeping that happens from an IT, information security perspective, right? And
yeah,
so that's what I meant about the infrastructure. Do we have the pieces in place in our IT infrastructure that actually mitigates against, like a not thoughtful person, right? Not that they're trying to do something wrong, but they inadvertently do something stupid that you've already trained them not to do. The policy says no, but there was no guardrail against it, right? So that's
hmm,
that. So we're doing kind of a combination of education and sort of guidance, but also a framework within which certain things aren't actually possible.
that's right. I want to switch topics slightly about the entrepreneurship side of this because you're right in the thick of it. You're a clinician entrepreneur. And I think someplace else I read, they need a new path, one that doesn't require venture backing to act on their vision. And I know you're certainly taking that bull by the horns, and I'm seeing it daily with you and how AI is changing what your path looks like at Avail.
Yeah, that's
What does that change look like for other NPs and nurses who want to build?
so. I'm non-technical, so I'm gonna so forgive me if I don't use the right words here. Um, so vibe coding is something that I have not got my fingers dirty yet in that because I'm busy,
I'm
running.
vibe coding while we're talking, Joe.
Yeah, yeah, exactly.
Keep going.
So, but from a non-technical perspective, imagine that you don't know how to write code. Right, engineering is generally software engineering is being able to use this lexicon that you have to be initiated in and understand, and then using these sort of structures to put code together that turns magically into things like this software that's enabling us to have this conversation from 1,000 miles apart, right?
Hmm.
And so what's happening right now with AI is it's actually putting the software development into the hands of the clinicians now. It's not just my CTO has 3 AI agents. What if I had my own AI agents to actually do the things that I know I need and I
Hmm.
know how I think they should work, but I was always dependent on this sort of, expert initiated in this special way of doing things that I don't know how to do. And so now we have this like interpretation is a way to think about it, right? Where you can say what you want, and then the AI actually interprets it into code structures and then shows you the outcome, and then you can give it feedback in normal human language that then
Hmm.
it takes that feedback and iterates it, and you can actually build software without that intermediary product and then intermediary engineer.
Well said. Well said. And I think the biggest use case that I'm seeing CEOs like you leaning on is like gather all your data sets and, in the right proper playground sandbox area, give it the data set and ask it to build the graphs, the charts, the analytics that you need to make smarter business decisions, and then you can go back to your CTO with the
Yep.
agents running and let him continue building the enterprise software. But you can really unlock so many
Little things.
little minor projects that might be throwaway in 2 weeks, but it helps you get what you need to do for a proposal, for a marketing thing, for an
Yeah, all that
analysis.
stuff. Like a good concrete example. Um, I was my director of business operations who works with our CPA to manage our books. That
Hmm.
we've turned on Claude Cowork for her because she can now what many of the things that she would do to generate like projections for me or give me insights into the finances that would take her like real time in actually doing that work. I mean, she could code the Excel spreadsheet, but she's still got to move the numbers around, she's still got to analyze it, she's still got to interpret it. She can literally task Claude Cowork to do whatever it is I'm asking, and then it just literally generates that outcome for you, right?
That's right. That's
That
right.
saves hours of her time, right? On a weekly basis, she's getting hours back. Now, for me, one of our people is building out what are all the resources for a vulnerable person discharging from the hospital in Rockville, Maryland, that might be available for us to help keep them aging in place and not going back to the hospital. A social
Hmm.
worker would spend weeks building out normally. I was able to have that conversation with the ops and then input the prompts into Claude Cowork, and it generated this two 2,000 different potential partners with their contact information, with their
I love it.
their address, all that stuff available, and that is a massive unlock for good, right?
That's right. Yeah. Yeah. Everybody gets to move up one rung on the ladder, if not two or three, if you lean in and use the AI. So, but I'm hearing underneath it all, Joe, is still the quintuple aim that you keep talking about: better outcomes, lower costs, better clinician experience, health equity, patient experience.
Yeah,
AI only gets you there if the people building it actually know what those five things look like on the ground.
that's true.
And that's exactly what people like you why you guys need to be in conversations like this.
Yeah,
So,
I appreciate that. Yeah, and the whole team, right? Diversity is an amazing asset because diversity, one way to think about diversity is it's the lens through which we see the world, right? Or the
mhm,
lenses through which, and we're not all positioned the same. We
that's
don't
right.
have the same duties as in work. We don't have the same lived experiences, et cetera, right? And so you can build for that quintuple aim by making sure that it's not just me, this white, straight, middle-aged guy with letters after his name, that's
Hmm.
deciding what the quintuple aim is. I have to be, my vision is informed by a very diverse set of thoughts and opinions, and not just from my past, but in real time, day after day, understanding what the patient experience is, what the provider experience is, and what the milieu is, like what's happening in that place.
That's right. That's right. There's such strong framing here, Joe. I mean, AI in healthcare is really only as good as the mission that you're building around it. Like that's where I keep telling people. Somebody asked me for advice just yesterday. I said, "But what are you passionate about?
Mhm.
What's your life's mission? Like go after that. You can make money doing anything,
Yeah.
and you've got a clear mission." Including 90% of seniors who just want to stay in their house. There's 63 million caregivers that are holding it all together in the United States. And I hope every healthcare leader and health tech builder watching this carries that whole mission and vision with them. So thank you so much, Joe, for being here.
Thank you.
How do people watching this get in touch? What should we put in the show notes?
Yeah. So our website is www.availhealthcare.co. And you can get, there's a message function in there. There's our contact information. We're active in 5 states right now: California, Indiana, Ohio, West Virginia, and Maryland. And we're happy to help. But we do, like you said, the behavioral health services. We also do mobile deployments for vulnerable seniors living in nursing homes. And then we're launching more care programs. We really believe you have to try to take responsibility for as much of the patient need as you can, so that
Hmm.
those patients don't end up having to interface with 5 different digital healthcare companies just to get their needs met. So yeah, reach out to us if you're interested, and we welcome just primary care practices. You want to talk to us, we're happy to help you. We don't replace you, we complement and support you.
I love it. Perfect. We're going to make sure all of Joe's links, including availhealthcare.co, are in the show notes. So you click straight through to them. To everybody out there, if this episode gave you a new way to think about what patient centered AI actually looks like in practice, please pass this episode along. Share it with a clinician, a healthcare entrepreneur, or a leader in your network who's building in this space, or have them reach out to Joe. Please follow the podcast, leave us a review. We want your feedback to make this better. And check out all the ways to connect with Joe again down in the show notes. I'm Brian Denstead. You've been listening to AI with Bri. And remember, the future doesn't wait. Learn, leverage, and lead. And we'll see you next week.
This episode of AI with Bri was hosted and produced by me, Brian Denstead. Produced with help from Nancy Velasquez and Kelly Lopez. Video by Leo Moralina. Sound AI generated. Find us on all platforms at AI with Bri and visit ai.bri.net for more. Learn, leverage, lead.